It's one of those evenings, okay? It's one of those days. Hi guys, how are you doing? Welcome back to another live stream. I'm so glad that you've caught this one today. It's been one of those days. In fact, it's been one of those last couple of weeks. If President Joe Biden thinks he's stressed, he should come and live my life. Oh my goodness, how are you doing? How are you all doing? I'm Dr. Sylvia. I'm a consultant in general practice, and this is AskAwayHealth. We're not going to stay too long on tonight's stream, but I had promised myself I wanted to tackle a couple of topics, and we're going to cover them just in a few minutes. So we're talking about menopause, and we're going to be talking about fibroids. The fibroids issue has come from one of our viewers, and it's a really interesting question, and I would like to address it. I'm going to share the link to the video. If you're the person who sent in this question, I'm so sorry. I know it's a few days. My response is a few days late, and I'm so sorry. I haven't been ignoring that question. I really wanted to take some time and answer it. And as soon as we finish this, or within the next few hours, I will post the link to the video into your question in my response to your question, so that you can sit down and have a look at it. And then hopefully that will provide some guidance or some explanation as you are requesting in your question. In your question. And then the menopause case. Today, I can't go into one of our menopause questions, but I did find an interesting menopause story that I want us to go through together and perhaps pick up 2 or 3 lessons from them, from the story. And, as my objective is to just share that information and help people who might be experiencing something similar to, gain some insight, gain some confidence to advocate for themselves and, get better help as they need it. So welcome. If you're joining this live, I really appreciate you. Hi, where are you watching from? What's your temperature like? Let me know what you're up to. I'm happy to take questions around the subjects that we're discussing today. Please remember that we're not providing medical advice of any sort or form. Let me put that up again. What we're doing is just sharing medical information with the hope that it can signpost you, direct your thinking, help you to go back to your licensed medical provider, who can obviously take things forward and provide you the right advice that you need for your specific situation. But you're welcome to ask questions. Please give this video a like, and don't forget to share it. I'm just having a look for my ticker. There it is. Please give this video a like and let YouTube know that we're doing something really useful here. And it doesn't cost anything. It's just a click, just a tap on your screen or a click of your mouse. That's the like. And you can even go on further and subscribe to the channel if you think that what we're doing here is really useful and you want to share it with friends. So without much further ado, let us begin. Did I ask you how you were? If I didn't, I'm so sorry. How are you? How's your day been? Sometimes it's just good to ask that question, that sense of connection. I hope you guys have had a good day. It's been a very busy day. I've been out of my house 3 times today, 3 times. And when I came back the last time, I thought, can I really do this live stream? But we're here. We're going to do it. Okay, seriously. Let us begin with the fibroids question. It has come from a viewer. One of our videos on this channel, I think we're talking about fibroids bleeding. And so they sent in this question, which I think is very instructive, because it shares the problems that women go through when we have fibroids, and not just having the fibroid plus its troublesome symptoms, but the challenge in terms of getting treatment. There's so many different experiences that, everyone is unique and individual. I completely agree, but this one brings it to the fore in a very good way. So let's read the question, and I'm just going to share my thoughts around the potential, what's going on, and then the next possible steps. And like I said, if you're watching this, please don't forget to like it, like the video, and please share it with somebody who might have fibroids, who wants to have a conversation about fibroids, wants to learn more about fibroids. Of course, fibroids are benign growths in the womb. Very, very common in women of reproductive age, becoming more common as we grow older. But they're also very, very common in women of Black, African, Afro-Caribbean heritage. What causes fibroids specifically, we don't know, but we know that there are different things associated with fibroids. For example, hormone imbalance, with estrogen and progesterone being sort of the major culprits when you come to look at the hormone imbalances. Lots and lots more research required for us to work out exactly what is going on that leads to fibroids developing. whether it's something that has to do with our genes or something that has to do with issues that arise while we're in the womb, whether it has something to do with the environment that we're exposed to, the food that we eat, and so on. There's so many different theories out there. There's some people that believe natural treatment is the way to go completely. Others do not. There's medical treatments. There's surgical treatments, different options for fibroids. I do have I think 2 playlists on this channel with lots of fibroid information. So please make sure you have a look if you want to get some more information. But let's look at this question. Okay, let's look at this question. So let me just read it and then we can have a think about what's going on. So she says, thank you for this. I'm in a situation where I have lots of fibroid trouble. They returned some years after a myomectomy 12 years ago. A gynae I loved prescribed Slind, which was amazing, and also recommended NSAIDs. I was doing great in regards to pain, fullness, and bleeding for a long time, but then I lost access to Slind and the gynae. After a recent vitreous bleed in my eye, an ophthalmologist told me to reduce or stop taking ibuprofen. I wondered 2 things. Could you comment on whether reducing fibroid bleeding is different from effects NSAIDs may have on other bleeding in the body? Second, could you comment on whether Opill, which is over-the-counter progesterone birth control, might also be effective in reducing fibroid size and especially bleeding? I've started taking it, and so far I'm having lots of bleeding, but I'm willing to power through that. If it's going to die down and leave me better off, I'm 54 and at my wit's end, and I would like to be an active swimmer again before I'm too old to enjoy it. Thanks again. What an amazing thought. What an interesting question. So we're going to go through that again, take it bit by bit, but that's the question that we have to tackle. It's a bit of work we're going to be thinking, but let me know if you have any thoughts or if you have any shared experience, something similar to this, and what happened in your own case. Again, this is not diagnosis or treatment, because as you have seen, we only had literally few lines of information compared to a full medical notes that your doctor would normally have before we can sort of make judgment or decisions. So we're not doing that at all. But I think we can sort of explain some of the issues around here, and then look at what options may be or may not. We may not be able to do that, to be fair, but let's give at it. Let's have a go. So I'm in a situation where I have lots of fibroid trouble. They returned some years after my myomectomy 12 years ago. She's had fibroids for some time. She's had surgery, myomectomy surgery that removes fibroids. And as is a common experience, they can come back after a myomectomy. A gynae I loved prescribed, and let's give a shout out to gynecologists and, not just gynaes, but every specialist that where you have a relationship with your patient, that they love you, because sometimes, and especially since I started looking into patient experience and advocacy, I have come across people really frustrated with doctors. And when you come across one that is loved because of their person or because how they've helped somebody, we really need to give a shout out to every single practitioner who's out there doing this thing that helps your patients, and they have that expression of feeling of love for you. Anyway, so this is the gynae prescribed Slind. Slind is a progestogen. It's actually one of the newer progestogens. It's a 4th generation type of progestogen. These are synthetic or human-made forms of progesterone. So that's what a progestogen is. And we just call them 1st, 2nd, 3rd, 4th generation, depending on when they were developed in the market, when they were produced. And this one, Slind, what's special about it is in terms of the kind of properties that it could have. So compared to maybe the older ones, things like levonorgestrel or norepinephrine that you have in things like the pill, like the morning after pill, this Slind is supposed to have less androgenic side effects like acne or less bleeding. I think that's what's useful. So let's not derail ourselves too much. Less bleeding will be the experience for somebody who's taking Slind. And she said this was amazing. And for her experience of bleeding with her fibroids. And this gynae also recommended NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. Examples are things like ibuprofen, things like naproxen, mefenamic acid. These are anti-inflammatory drugs. And so you might wonder, what is the relevance of that to fibroids? Well, when fibroids happen in the womb, they stretch or distort the womb, and so they can increase, because of that irregular bulky nature of the womb, there is definitely going to be an increased likelihood for bleeding. You have more muscle mass within the womb, you have more blood vessels, and you have more chemicals being produced, and you will have more bleeding. And so that is what would happen. But we have learned that NSAIDs, to different degrees, so different effects, can have some benefit on the bleeding from the fibroids. So they could help to reduce the production of certain chemicals which promote the bleeding from the fibroids. So that's why the doctor recommended NSAID. So she was on 2 drugs to help to control her fibroid symptoms. Neither one of them will necessarily shrink the fibroids, excuse me, but they can help contribute towards reducing the bleeding that you might experience on the fibroid. She didn't tell us how long she was on this combination, but she says she was doing great in regards to pain, fullness, that is, or bloating, and bleeding for a long time. And then sadly lost access to Slind and her gynae, her beloved gynae. After a recent vitreous bleed in my eye, an ophthalmologist told me to reduce or stop taking ibuprofen. To cut a long story short, she developed, I presume she may have experienced something called vitreous detachment, which is when, within the eye, there's a kind of gel-like material inside the eye that's sort of closer to the back of the eye, which helps in focusing and clarifying our vision. And it's there from birth, as we age. But the thing about the gel is, as we grow older, it starts to become a bit more watery or fluid. And so the potential that it can detach from the retina, that is the back of the eye, increases as we grow older. Sometimes it's more common after surgery, or if you're short-sighted like me. But I think that's what she experienced. And then one of the complications of that will be a bleed, because when that vitreous liquid or gel detaches, there may be sometimes, there may be, not always, but there may be a little bit bleeding in the eye. So when she went to see the doctor, the symptoms for that may have been things like floaters in the vision, or flashes of light. I don't know, but she may have experienced that. She went off to the ophthalmologist, and in terms of her review, part of what they asked her to do was to stop taking the ibuprofen. Let me just pause. Let me just pause here and say hello to, hi Dorian Persian. Thank you so much for joining. Thank you so much for clicking on the live. I'm at 60s. But after 13 years of menopause, I still have hot flashes, especially this year. I really have hard time more than the last year's hot flashes. One of the things that we can't predict is how long that an individual person will have hot flashes or night sweats or all that when they come into menopause. Thank you for sharing that. It'll be interesting to know whether you have any treatment, or did you have HRT, or did you use any other type of treatment, anything at all to deal with your hot flashes, Dorian? Tell us in the comments. Okay, let's go back to this. Let's go back to our story here. So she had a bleed. The bottom line is that she experienced abnormal bleeding. Okay, this was in the eye, but it could have been in the stomach. Okay, it could have been anywhere else, really, in different scenarios. But the bottom line is that something happened, and then she experienced a bleeding problem. At which point the ophthalmologist says, stop taking ibuprofen. Now, this is where her first question comes, okay? She says, could you comment on whether reducing fibroid bleeding is different from effects of the NSAIDs may have on other bleeding in the body? So let's just take a pause here and sort of deal with this. Let's deal with this question. Okay, so you're taking ibuprofen. Let's use that as our example of NSAIDs in this. And we tell you, your doctors will tell you that ibuprofen good anti-inflammatory drug, but it does have side effects. One of the most common ones that we will drum into your head is that it could cause indigestion, heartburn, because it's known to irritate the lining of the stomach and the food pipe. So we ask you to take it with food, never on an empty stomach. But of course, it could have so many other symptoms. It could also cause bleeding from the different parts of the body. In fact, one of the side effects is just listed: bleeding, hemorrhage. That's the side effect. So it's left for you to think, right, that bleeding could happen anywhere. But one of the common sites is from the stomach. So people could develop very serious bleeding from the stomach because they've been taking something like ibuprofen without any stomach protection for it could be a short or prolonged period of time. Why does it do that? It's an effect of the drug. It could irritate the lining of the stomach, but it could also have an effect on the chemicals within the stomach. So it can block those chemicals that cause the blood to clot. Okay. And that's why something like aspirin, which works in the same class of drugs, is known as a blood thinner. So basically, if you're taking ibuprofen, one of the side effects is the effect of bleeding. It's different when it comes to the womb. This same drug, and some drugs can have double effects in the body. This same drug in the womb can do something that appears different. So in the womb, it will block certain chemicals in the womb that promote bleeding, that open the blood vessels up. Remember, we said, and this can affect people with fibroids or who have heavy bleeding, or people who don't have fibroids but experience very heavy bleeding. And the chemical really is prostaglandin. But when you have fibroids, that also makes the chance of bleeding a lot higher because you have more blood vessels to deal with. But the bottom line is that when you take an anti-inflammatory drug like ibuprofen, the effect in the womb is to block that prostaglandin, and so it stops the effect of that chemical. The effect of that chemical was to open up the blood vessels and promote bleeding, but ibuprofen blocks that, and so by so doing closes off or tries to close off some of the blood vessels and reduce the bleeding. So going back to the question, this is the benefit that our friend here was experiencing with her ibuprofen. It was doing that effect on her womb. Presumably, I don't know whether she was taking something to protect her tummy. She didn't have any side effects to that. However, the moment she had that bleed in the eye, her eye doctor said to her, stop or reduce the amount of ibuprofen because it could make the bleeding in your eye worse. And bleeding in your eye, the implication of that is potentially losing sight, going blind. So that's why the eye doctor would say to her, stop the ibuprofen. And remember that she was doing great on her Slind and ibuprofen for a very long time. So now this is the challenge that we're having here in terms of her treatment. She's lost Slind because I don't know why she lost Slind, actually. I don't know. And, she lost her gynecologist, and then she lost the ibuprofen. The two things, or the three things that were keeping her symptoms nicely controlled. So the first question, could you comment on whether reducing fibroid bleeding is different from effects? Yes, the answer is yes. There are two different effects. Because of the way this drug works in those different tissues. And of course, we have to look at the potential for bleeding and potential complication of damage to your sight. That is really important. And that is why your eye specialist has advised that you stop ibuprofen. So ibuprofen had that beneficial effect on your womb because of the way it was blocking the chemical that was contributing to excess bleeding with the fibroids present. But ibuprofen also has a potential of worsening bleeding, seeming to make the blood thinner and increasing the potential of more bleeding. And since you've had a bleed in the eye, they didn't want to complicate that to make that worse. The second question is, could you comment on whether Opill, that is the over-the-counter nogestural birth control, might also be effective in reducing fibroid size and especially bleeding? She didn't say whether the Slind, or we don't know, what her experience with her fibroid size was. So, I can't comment to that. What I can say is that the progestogens are different. So the Slind, like I said, is a fourth generation, while the what you call nogestrol, that's the old pill, is the second generation. What is relevant in terms of this discussion is that I think that where Slind would have given you a bit of relief from bleeding, pill may not be able to do that job because it seems to have a higher potential to cause irregular bleeding than Slind. That is what is written on paper. That seems to be what is evident on paper. But is it worthwhile trying? It's probably worthwhile trying. We're all different. And the way that you respond to this pill may be different. You know, all these positions or opinions are based on studies, and there are some people that may respond in the way the people within the study responded. Some people might be outliers and they don't respond exactly that same way. So I would keep it in mind that there's a potential that pill might cause irregular bleeding. It may not have such a beneficial effect as Slind. However, it is reasonable for a period of time to use it and see how your body responds to this. Now, this is where we will insist that, of course, you're sitting down with your practitioner, your gynecologist, your general practitioner to look at your own specific medical history, your specific medical condition, to be able to discuss what appears to be most appropriate for you. But in terms of sort of, you know, looking at them one-on-one, comparing them and looking at what the academics say, what is written about those drugs, then I would expect that there may be irregular bleeding more with pill compared to Slind. So I think it's worthwhile having a discussion with your doctor. So might it be effective? I would say a 3-month period is reasonable to assess. 3 to 6 months, if the bleeding is not horrendous, is reasonable to assess. If it's completely haywire, flooding, even within a few days, please go and see your doctor to review that. But if it's sort of niggly bleeding that's not going away and you want to sort of sit with the pill for a few weeks, perhaps up to 3 months, to see whether the effect settles down into your system and then improves, that's reasonable. But I would have a conversation with your doctor. So I really, I really empathize with your struggle. I believe that at 54, you've still got many, many, many more years of swimming ahead of you. And I think you will achieve that. I think it's a good thing to sit down with your doctor and sort of, let's place all the cards on the table. What options do I have now? And I know that, you know, one of the options will be, let's just talk about the elephant in the room. One of the options will be a hysterectomy, because it may be that at your age, there may not be any medication. There may not, but they may. So it's worthwhile having that discussion. And I'm just sort of guessing, because I don't know your medical background, menopause and things like that. So there may be some drugs that they feel would not be suitable, but you know, you need to have that discussion with them and see what are the options. Let them lay it out, let them lay them out on the table. Then you go and have a think about them, and then decide which works best for you. So thank you so much for sending in this question. I hope this discussion around it has helped. Again, it's not to give any specific or direct answers, but just to explain why, you know, the eye doctor was giving that advice, why it seems that ibuprofen is doing one thing here and doing another thing there, and you know how pill and Slind might compare one to another. But I think the most important thing is about having that conversation with your doctor. Okay, guys, let's take a short break. Please give that button a like. If you've not pressed it yet, please press it now. Just a quick break. But while I'm on a break, press that like button. Okay, I'm back. Hi, hello. So the next part of our stream today is looking at menopause. I haven't got any prepared questions today. There just wasn't any time, but I did come across a story that I want to share with you, and I just want us to have a little conversation and then, see what you think. Again, any comments or thoughts, please feel free to share them in the comments section. Very much welcome. So let me share my screen. So hopefully you can see this. Yeah. Oh gosh, no, let me make it bigger. That's better. Okay. Let's go right to the top. So this is a story. This is from the Eye paper. Anyway, the story is menopause almost led me to suicide. It felt like no one believed me, which, I was like, what? Goodness me. What? So I had to read this to find exactly what was going on. And the more we learn and the more we give attention to menopause, we realize just how much impact. And I don't want us to stop talking about this so that we all feel confident about speaking about this phase of a woman's life that is natural. For many women, thank God for them, they don't really have any trouble. But there's some of us that do have problems who it seems as if your life is almost turned upside down one day, or you were fine, you were doing things and okay, not necessarily one day, because we know that it's a transition phase, but there might have been a time when you were on top of things and all of a sudden you've lost that for some reason, and you don't know what it is until somebody who appreciates the condition shares with you and says, right, I think this might have been menopause. Or that I think this is menopause. So I don't know if you can see this. Let me just make this bigger. No, it doesn't change the size. So okay. All right, let's read. I'm not going to read the whole thing, it's quite long, but we're going to just go through a few points. So when Andrea Newton began experiencing low moods, became tearful, and suffered a loss of confidence, she approached her GP, excuse me, about whether it could be related to her hormones and possibly be the menopause. However, when her gut instinct was dismissed and she was prescribed antidepressants and anti-anxiety medication, she felt an overwhelming sense of powerlessness and a feeling as if no one wanted her around. It's a really, really sad, feeling. And this lady had quite a lot of things going on. Let me just mute this video. She had a lot of things going on in her life. But let's say, in her own words, she says, I almost took my own life as I was going through the menopause, but it felt like no one believed me. I felt unworthy and incapable, and the GP's attitude didn't help. I felt like I was being gaslit. Last week we talked about somebody who felt they were being gaslit in respect of their symptoms, and it's something that's quite awful, this experience of not being listened to or taken seriously. Because somebody, especially a medical professional, when you're trying to unburden yourself about a problem that you want to share, and our role is actually to help shoulder a little bit of that burden and then just help you to move forward with it. Because we can't take it off you altogether, but we can sort of share your experience and then just help you move forward with it. And I think just listening and considering is a big part of that work. So it talks about some study that's been done. It highlights that is this study that's recently been published in the Australia and New Zealand Journal of Psychiatry, co-authored by one of our UK menopause specialists, Dr. Louise Newson. Anyway, this study highlights that the decline in estrogen levels significantly disrupts the balance of neurotransmitters. In short, the effect on the brain. And we talked about this last week, and I have the video, I clipped the video out and I put it in a standalone video about anxiety, about this effect on the brain, that it's not just the effect of estrogen from the ovaries reducing and then affecting things like hot flushes, night sweats, and so on. There is also an effect in the brain. Anyway, this disruption is linked to increased rates of depression, anxiety, and cognitive impairments, that's trouble with memory, such as brain fog. So this lady, Miss Newton, 57, she told the newspaper that she had been going through a difficult divorce around the time of her menopause, and this might have confused the issue. But she says she went to the doctors many times about her low mood, anxiety, and depression when things wouldn't get better. And she was told that she wasn't menopausal many times, after having what are now known to be unreliable hormone blood tests. So this is the first lesson that I just want to remind us about. Let me stop sharing so we can look at ourselves. So this is the first lesson, especially here in the UK, really around the world, but it all depends on the interpretation and the discussion that you have with your doctor. If you go to your doctor and say you think you might be menopausal, is there any test that we can do to confirm that? The reason why your doctor might say there's no test to confirm, the way that you would do, the way that you might do a urine test if you've got a urinary tract infection and then it comes back positive with blah, blah, blah. Or if you do a swab test for a sexually transmitted infection and it comes up positive with blah, blah, blah. So there isn't a test that comes back and it is positive for menopause, okay? What we can do, though, is we can check the levels of your reproductive hormones. But we can't really, the results don't really help us to make a determination of whether you're menopausal or not. Because around the time that we're doing this blood test, those hormone levels are fluctuating, they're in flux, they're going up and down. They aren't in a steady state. To be honest with you, the only time that we can use those blood test levels to say, right, you're menopausal, is when the levels have finally dropped way past the age when everybody knows, yeah, you're likely menopausal. So at the age of 49, 51, 52, they are still fluctuating. In other words, even if the result comes back, it may come back within a level that seems to be normal. That doesn't mean that you're not experiencing perimenopause, because those levels, so we can't rely on those results to categorically say that you are menopausal. They're fluctuating, so we can't rely on them. There's nothing wrong with them, but they're not useful for telling us whether you're menopausal or not. So that's why your GP wouldn't offer them to you as a way to determine if you're menopausal. And if you asked for them, they'll probably explain this to you, that those levels are not really, that those blood tests are not really reliable, because they can't tell us what we want to know. They're still going up and down. The levels haven't per se, won't demonstrate to us that this lady is going through perimenopause. They won't do that, or menopausal. The point where they would go down to such an extent, probably very well into your menopause, when you're not really asking the question anymore. But it's when you're asking the question that you want the test to be able to answer to you, but they are not doing that. They can't do that. So your doctor might explain that to you, or you might insist you want to have the test. Okay, fine. And you have the test. Now, how do you interpret the test? That's the challenge. And the reason I've taken time to really explain that is because of what this lady says here. Let me go back and share the screen. Is because of what she said in the next bit. So she says, when she went to the doctors on multiple occasions after her low mood, anxiety, and depression wouldn't lift, she was told she wasn't menopausal multiple times after having what are now known to be unreliable hormone blood tests. I don't know what is now known. We've always known that we can. When did I finish training? I mean, I've been a GP for quite a few years now, and during training, we were told, we knew that these tests are not reliable for telling a person that you are menopausal. So these are FSH and LH tests, are the standard ones that we will do. You can get your levels, but it won't tell us specifically. So that's the point. I think somehow there was a reliance on the tests to indicate whether or not she was menopausal instead of the symptoms. Let me come off shared screen again. There was a reliance on the tests instead of her symptoms, because knowing her symptoms, monitoring what's happening with her periods, our definition of menopause is that when you have had 12 consecutive months without a menstrual period, then you're menopausal. That's it. So, you count. That's, at the moment, that's what we use for our menopause diagnosis. Let me say hi to a couple of guys in the chat and see what. So Dorian came back to say, I did all the tests. I didn't have any special problem. They told me some women have hot flashes for entire life. I used most of these supplements like Menopause and the other supplements, but none of them helped me. Well, do you know what's Menopause? There's so many different supplements. I don't know what is in Menopause. Well, it's a good thing, you know, Dorian, to have a conversation with your doctor. Okay, I don't know whether you discussed HRT. I don't push HRT for the sake of pushing it. It's not for everybody. I agree. And doctors wouldn't just give you HRT without making sure that it's suitable for you. But it is, to date, for many women, one of the best treatments for hot flushes. So that's why I asked you what treatment you've had. And I don't know what was in those supplements, so I can't really comment on them. But if that's something that you hadn't thought about or considered, perhaps it's time to have a conversation with your doctor, you know, to see if that's something that could be of any use. And thank you so much for everyone else who's joining the stream. Really appreciate you. I'm only going to be taking questions related specifically to the subject that we're talking about, which is menopause. So let's continue with this story. We're nearly done. So we've talked about the blood test. We've talked about why they wouldn't be of any use. So we've also said that she had a lot of things going on. She was going through a divorce and emotional stress that she was going through. So she said, after a couple of years, when everything on a physical level was much better, my mood still hadn't improved. I was 51 when I went to see the GP. So remember that most women on average will sort of go through perimenopause from the late 40s and probably start to approach, you know, menopause around their early 50s, 51. So she went to see her GP. So she said she suggested to the doctor, and the doctor didn't. So we've read that, haven't we? So the doctor said the results didn't show she was menopausal and that he thought she was experiencing depression, and he prescribed her antidepressants and anti-anxiety medication. So we now know that the blood test tells you absolutely nothing. She was given an increased dose of anxiety drugs, got to the point where she felt spaced out all the time. She was clearly a very busy person. She ran her own business and public speaking business, goodness. So she was really struggling. She said she knew it wasn't depression. It wasn't the result of her divorce. She knew there was something more. She said things came to a crunch by the age of 54. So she went on with this for more than 3 years because it started before her 51st birthday. Anyway, she said she went to see a friend and there was some kind of mix-up, and you know, she came off with the wrong idea and she felt as if nobody wanted her around, and she really felt as if she just wanted to end it all. And what stopped her was having her dog, you know, her concern that what would happen to her dog. So she went home and called one of her friends. And that's the second thing that, you know, it's really important in terms of support. And we're living busy lives. I was saying this to myself not too long ago. We're living very busy lives. Every one of us are living very busy lives and maybe not taking enough time for friends, for, you know, loved ones, and how important it is to have that support system. Because the next part of the story, so if you're somebody who's very busy, please make time to, you know, reach out to somebody, make time to schedule, even if it's a phone call or just, I don't know, something with a friend or someone that is within you can have a small circle. A small circle is fine, but don't have no circle. So anyway, she said she went home, she called a friend and told them what she'd almost done. And this friend, who lived 5 hours away, drove straight up to be with her. So after telling her GP that she intended to take her own life, she realized the GPs are not routinely trained in suicide prevention or menopause awareness. Because his suggestion was to take away all her medication for a couple of weeks and see what happened and then start again. So this doesn't show us in a very good light, us GPs. And this is a nice, lovely picture of this lady, I think probably in a better place than when she was going through all that. So yeah, we're not routinely trained. I presume that means that not every GP will go through a psychiatry rotation in training. I presume that's what it means. Although you go through that in your foundation year. But some doctors will, but all GPs know that you can refer patients to for further assessment with the crisis team or the mental health team if needed. So we have enough in our training, and there is thankfully a lot more work being done at the moment to help train us in menopause care. So I think the situation is improving. Clearly, when she was going through this, it wasn't, she didn't get the support that she needed. So to cut a long story short, I'm going to place the link to this story in the description after this, and then you can read everything. To cut a long story short, she found a menopause specialist. After chatting for less than half an hour, she was told she was menopausal, given some HRT, and started to feel better afterwards. So I think for me, what was really, of course, thankfully, she got the help that she needed, got the support that she needed. I think that's really important, and was able to find out what was going on. So, realizing, what's menopause. If you're having questions around what is it, am I in menopause, am I not in menopause, very, very clear that we haven't got anything, like a blood test that will tell you whether you're not, because those tests, we can't rely on them for that purpose, because the levels are, you can't rely on the levels. And then the second thing is, we will say that you're menopausal when you reach a particular stage. The other thing that's challenging about menopause is the fact that so many other conditions can mimic. There's so many other things, like the case that we discussed the other time. I think somebody with ovarian cancer that was presenting with bloating, and they thought it was irritable bowel and some other symptoms, where they put irritable bowel in the mix, they put menopause in the mix, and before they knew it, they had pretty much missed the diagnosis of ovarian cancer. So there's so many different symptoms, the possible symptoms that can happen to a menopausal, perimenopausal or menopausal woman, over 60 of them. So, but I think with listening to somebody, that is from the point of view of the clinician, listening to the person, taking into account everything that's going on around them, then perhaps we can consider, if not the first and the second time when your first treatment didn't make any difference, then we should be able to consider that. So please, ladies, go back, question, is there something else that we could be doing? I'm not feeling right. Don't give up, please. Put it in mind. Hopefully none of us ever has to get to that point that this lady was, where she was overwhelmed by her feelings, that she thought it wasn't just worth continuing. This is somebody who's built a business, she's got a child, and all sorts of things, and we don't want to get to that point. So guys, that's where I'm going to draw the curtain tonight. I'm glad that I spent this time with you. I really thought we weren't going to make it, but I'm so glad. I wanted to get the stories off my chest, and I hope somebody has found some benefit with them. The discussion about menopause, and of course the earlier discussion about fibroids. So the important thing I'll say is, don't forget that you can speak to your doctor about these symptoms. I do have an email health information service. So if there are any questions that you want to send, that you'd like some direction, that you'd like some further discussion around, please feel free. Go onto our website, AskAwayHealth.org. In fact, let me just show you, and then I can share my screen. Hang on, let me... I'll show you where it is, and I can share my screen. You're welcome to come onto that. And then, give me a second. Okay, so let me share my screen. So if you wanted to have a further discussion, like I said, any questions that we're not covering here? Yeah, that's it. Okay. So hopefully you can see my screen. Can you? Yeah, okay. So that's AskAwayHealth.org. That's our website. Scroll down to the bottom of, no, the middle of the page, I beg your pardon. That's the email health information service. That's a picture of me when I wasn't flustered. I was really chilled and relaxed. Click on the blue button, ask me a question, and that opens up the service, and it allows you to put in as much information, and then we can respond to your inquiry. Okay, so fantastic. Thank you so very much for joining. Okay, there's a couple of questions. So Patricia, Sunil, you're going to have to use the email service for these questions. Well, thank you for popping in. Really appreciate you for doing that. But for these questions, I would love you to use the email service because I can't respond to them here. Omen, Tina, how can the fibroid stop? I don't know anything about this fibroid. You're welcome to put some more detail by using the email information service. That will really be useful, and I'll be happy to respond there. lots of different treatments for fibroids. I have got a playlist for fibroids, and that looks at different fibroid treatments, different fibroid treatment options, medical, natural, surgical options. And so you know what you're getting with each. You know that's some can control symptoms, not necessarily cure the fibroid, so that you understand what you're getting. But the important thing is having a discussion with your doctor about your specific symptoms, and then they can help you with them. Okay, thank you so much for joining tonight, guys. I hope you all have a great week ahead. Please check out the other videos on the channel. I have got a few that came out last week, and of course some coming out later on this week. I hope the rest of your week goes well, and I'll see you again soon. Bye bye, guys.